Medication information should not only be available, it should be understandable, usable, and relevant to the committee receiving it. The Temiar Medication Literacy Innovation Kit, locally known as Moklat Ubat Act, was developed by the team MEDITIAR to make trusted medication education more accessible for Temiar-speaking orang asli communities. University Kuala Lumpur Royal College of Medicine Perak is a MARA subsidiary institution that applies pharmacy expertise beyond the classroom through education, healthcare collaboration, and community-focused innovation. This project demonstrates how institutional knowledge can be translated into practical solutions for an undeserved population. One of these needs can be seen in Kuala Mu, a remote Temiar orang asli settlement in Sungai Siput. Distance is only one part of the challenge for this community. Language differences, tax-heavy materials, and limited cultural adaptation of the medication education may reduce understanding of this community for important medication messages. Information may exist, but it does not always become knowledge that the people can remember and apply. This creates a preventable gap between available medication information and usable medication knowledge. The National Kenali Ubat Anda program already provides trusted clinical medicine information. Our innovation does not replace the content. Instead, it redesigned how the information is communicated. Standard Malay and text-led explanation were adapted into a Temiar-first pictogram-led format. Each page focuses on one principal concept, uses familiar visual cues, and incorporates teach-back to verify patient understanding. This is therefore more than direct translation. It is a culturally and linguistically adapted communication system. The project began with consultation with bahagian perkhidmatan farmasi to align the innovation with the National Kenali Ubat Anda program. This was followed by 3 focus group discussion involving 9 healthcare stakeholders and 3 community discussion involving 11 community members. Jabatan Kemajuan Orang Asli and Tok Batin representative supported the community engagement and local relevance. The content was then culturally and linguistically adapted, reviewed by a multidisciplinary expert, pre-tested with the committee, and revised before field implementation. The completed kit was pilot tested with 100 Temiar-speaking orang asli adults in Sungai Siput, Perak. All the medication-related knowledge, attitude, and self-reported best practice was measured pre- and post-intervention. All 3 domains improved significantly. Community feedback also explained how the innovation supported their understanding. The Temiar language enhanced the accessibility, the usage of pictogram reduced the dependence on reading fluency, and the simplified explanation increased their confidence, and visual content supported the engagement. As a single group pilot with an immediate post-test and self-reported practice outcome, these findings support preliminary usefulness and feasibility rather than long-term causal effectiveness. The innovation is currently positioned at Technology Readiness Level 6. The prototype has been completed, validated, and demonstrated with its intended user in a real community environment. Each kit costs below 20 ringgit to produce and can be used during facilitated session. The original design is protected through MyIPO copyright notification. The primary pathway is the institutional adoption rather than direct retail sale. Potential adopters include bahagian perkhidmatan farmasi, Jabatan Kemajuan Orang Asli, public health facilities, universities, pasukan bergerak orang asli, NGOs, and those in community outreach program. Implementation may involve institutional printing, facilitated training, and cultural adaptation partnership. Sustainability can be strengthened by integrating the kit into the existing outreach program and maintain structured updates to the content. For MARA, this innovation demonstrates how expertise within a MARA subsidiary can be translated into practical community impact. For Temiar community, it provides medication information that is more accessible, culturally relevant, and easier to understand. It also strengthens collaboration between universities, healthcare agencies, Jabatan Kemajuan Orang Asli, community leaders, and frontline facilitators. This innovation contributes to SDG 3, good health and well-being, SDG 4, quality education, and SDG 10, reduce inequalities. Its broader potential lies in the adaptation process itself. The goal is to scale the process and not simply the product, so that future version can develop responsibility for other communities and languages. In conclusion, medication education should be adapted to the communities it serves. Temiar Medication Literacy Innovation Kit, understand medicine, strengthen communities. Inovasi hari ini, impak masa depan.